Assalamu alaikum. Now we are going to talk about the interior of the skull. If we look at the skull, this is the exterior of the skull and all the normas, and this is the interior of the skull. This is the part that lodges the brain. So if we look at the interior of the skull, we can see that there are some anatomical points that demarcate the interior into some cranial fossas. So there are three cranial fossas: the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. So we will talk about them. How we describe these fossas is that we talk about their boundaries, their floors, and then the main points that are present in these fossas. So for the anterior cranial fossa, how we describe it is that it is bound anteriorly and laterally by the frontal bone. This is the frontal bone. So the anterior cranial fossa is bound anteriorly and on the sides by the frontal bone. It is bound posteriorly by three bones. How? This is the lesser wing of the sphenoid. This is the anterior clinoid process, also of the sphenoid bone, and this is the jugum sphenoidale, the anterior most part of the sphenoid bone. So three parts of the bone form its posterior boundary: the lesser wing of the sphenoid, the anterior clinoid process, and the anterior margin of the sulcus chiasmaticus, which is also called the this bone is also called the jugum sphenoidale. Now if we look at its floor, the floor in the median plane, it is formed anteriorly by the Cribriform plate of the ethmoid bone. This quadrangular plate is called the Cribriform plate of the ethmoid bone, and posteriorly this part is formed by the jugum sphenoidale, the anterior most part of the body of the sphenoid, called the jugum sphenoidale. On each side, the floor is formed by the orbital plates of the frontal bone, and posteriorly the lesser wing of the sphenoid. Now if we look at the cribriform plate of the frontal bone, this is the part that separates the anterior cranial fossa from the nasal cavity. It is present in the midline, so it separates the anterior cranial fossa from the nasal cavity. It forms some sutures. What sutures are present here? It forms anteriorly the frontoethmoid suture with the frontal bone. Posteriorly, it forms frontosphenoid suture with the sphenoid bone, the part that is the jugum sphenoidale, and laterally it forms the suture with the orbital plate of the frontal bone. Anteriorly, where the frontoethmoid suture is present in the midline, there is a foramen. This foramen is called the foramen cecum. This foramen is almost always blind. After that, where it forms the margin with the jugum sphenoidale, on its lateral edges here and here are the posterior ethmoidal canals, which transmit the posterior ethmoidal nerves and vessels towards the nose. Then on the lateral margins, where the suture with the orbital plate of the frontal bone is present, there are anterior ethmoidal canals. These anterior ethmoidal canals transmit the anterior ethmoidal vessels and nerves towards the nasal cavity. If we look at the cribriform plate closely, you can appreciate that it is porous. It has many small openings in it. These openings, that is why it is called the cribriform plate, because it has many openings. These openings are for the olfactory nerves that are going to enter into the skull through this cribriform plate. In the midline of the cribriform plate, there is a projection. This projection, you can see this projection. This projection is called crista gyli. On each side of the crista gyli, as we said, there were some sutures on it. Alright, the jugum sphenoidale, it is the anterior part of the sphenoid sinus, and this part separates the anterior cranial fossa from the sphenoid bone. The orbital plate of the frontal bone is the part which separates the anterior cranial fossa from the orbital cavity, this eye. So this is the part that separates the anterior part of the skull from the orbit. As we can see that this part has some projections. These are the projections of the sulci and gyri of the brain. As the brain rests, the frontal part of the brain rests on this bone, so there are projections for the sulci and gyri present on this part. Alright, frontal air sinus, it can extend onto the anterior part of the orbital plate of the frontal bone as well. The lesser wing of the sphenoid, this is the part of the lesser wing of the sphenoid, this is the suture. This is the part that forms the posterior boundary of the anterior cranial fossa on both sides. Here it is missing. It projects onto the middle cranial fossa. We can see that it is projecting into it. My fingers are moving internally. This is the part that projects into the middle cranial fossa, and it is laterally, it is wider as compared to its medially it is wider, and laterally it tapers down. Medially it is continuous into the anterior clinoid process. This process, which is extending backwards, is the anterior clinoid process, and this lesser wing of the sphenoid and attaches anteriorly with the jugum sphenoidale, which is the anterior most part of the body of the sphenoid, which separates the anterior cranial fossa with the from the sphenoid sinus.